my two questions for you are, one, did concerns about population diversity influence how the Moderna vaccine was developed and tested? And the second is, now that the mRNA vaccines have been found to be effective, what are your thoughts on what vaccine science can do to build in more equity in developing new vaccines and distributing them?
Well, first of all, I want to thank Nina and the others, and Marianne, for the invitation. This is quite, I think, a very noble effort here, and very timely as well. So let me take your questions in order. First is about population diversity. And first of all, this is probably one of the most timely and important issues right now. Of course, we're trying to actually get the vaccine to as many people, not only in the United States, but also in the world. And there are a number of reasons why diversity is important. So I want to just take a minute to emphasize those. And they really divide up into the variable responses that the vaccine has in terms of safety and efficacy in distinct subsets of patients. These break down to medical issues, age issues, pre-existing conditions, of course, gender as well, particularly in some of the side effects. Autoimmune patients that have autoimmune problems, cancer chemotherapy, transplant patients. And it turns out a lot of these patients were actually excluded in the trials, and we're discovering that these patients actually may not mount a fully protective response to the vaccine. I think everyone's aware of the age issues and how some younger individuals, particularly children, for some reason, are not as susceptible. And then, of course, the pre-existing conditions. So I think this is a big issue. Now, what are the sort of issues right now in terms of diversity? And this is, first of all, I want to say that I'm not speaking on behalf of Moderna. I'm speaking on behalf of my own personal views. And actually, right now, I have no formal relationship with Moderna, aside as a cheerleader, I'd say, at this stage. And so in the United States, the way I see it right now, and this is my own perspective, I think there are a number of barriers that we have related to vaccine hesitancy. These break down into individual regions. I think others are much more familiar with this and are expert in this than I am. And I also want to say I wish that we, and I use the royal we now, speaking for the entire field of mRNA vaccines for a minute, had given more concern to these in the outset. We should have seen these, I think, quite frankly. These break down into rural issues, inner city issues, ethnic issues, language issues, cultural issues. And I think you're all very familiar with that in the United States. It's on the TV every night now. Globally, there are other issues, of course, and these relate to a number of problems with the vaccines, the mRNA vaccines that I'm speaking for right at this point. The need for refrigeration, in certain cases, ultra cold freezers, stability, also the need for multiple doses, also the need for the cost related to it. They're much more costly, and also scalability. And then finally, I think, and related to, I would like to say one thing, that Moderna did actually slow down its recruitment because it wasn't diverse enough, and that slowed down our reporting of the phase 3 results. And that had quite a big impact because Moderna was substantially ahead of Pfizer and BioNTech in terms of timelines. In other words, we had started initiating the vaccine way before they had. And that was a very difficult decision, but the appropriate decision was made. And diversity is clearly reflected in the phase 3 results. So I think that is, I'd like to say that clearly. In terms of how to get this and to build more equity and diversity, one of the hot topics, of course, now are patents. And the idea is, and I think it's a noble idea, is how do we get more of these mRNA vaccines that appear to be best in class at this point to more people? And I think that that's, again, a noble, meritorious goal. The barriers that I see, though, are substantial, and I'd say this from a technical standpoint. First of all, refrigeration, freezing. Not every place will be able to have access to these from that standpoint. Stability. You need 2 doses. You're going to have to bring back people back for a second dose. Cost. The cost of nucleotide for a unmodified nucleotide to make unmodified mRNA is versus the modified. The modified is 50-fold more expensive, just to give you an idea of the cost differential. And of course, scalability. Now, what's interesting with the patent discussion, I don't know if you're aware of this, but Moderna has already taken the position that they will not enforce their patents. So actually, anyone can go out and make the Moderna vaccine. We know what the components are, and it's wide open from that standpoint. But I see, you know, one of the difficulties here, and I'll make an analogy that may be kind of crude, but, you know, we're all starting to go to restaurants again, and, you know, we go to our favorite restaurants, and we've all tried to make whatever our favorite restaurant was making, probably at home recently. But you realize it's hard to do. One is you can't get the right ingredients. 2, you may not have the instrumentation that they have. That there's, you know, some of these restaurants are quite fancy. You can't get the foam right. You can't get whatever. I mean, there's all sort of kind of a molecular component to gastronomy right now. And you can't get the ingredients. And even if you had all that, you still don't have the know-how how to put it all together. And it's one thing if it's a meal and, you know, okay, it didn't turn out right. It's another thing if it's a medicine that's going to go into people. And it's going to people who are trusting that this is the same thing that we're getting in the United States. So I feel fairly strongly that safety is going to have to be at a minimum, let alone efficacy, proven with these. And by the time you get done that, it's not going to help us. And I think the key is we got to figure out how do we get this done now? Okay, time is wasting. Now, I do think there's a role here for other countries to collaborate and form consortiums, and we can discuss that at a later time. But I think those are the points that I think are important. One other thing is that the other vaccines that are non-mRNA, I actually believe are going to save the world, not the mRNA vaccines. And the reasons are very clear. It's pennies to the dollar in cost, no refrigeration, single administration. And one of these is looking quite good, Sanofi and GSK, which is not an mRNA vaccine. It's a protein-based vaccine. And then the DNA vaccines like AstraZeneca are actually looking good. They look like they affect the variant. The problem right now is the major site that AstraZeneca designated to generate the vaccines for the entire world, pennies on the dollar, including India, is in India. And they're so affected by COVID, they can't even manufacture the vaccine. But that is starting to break. So what should happen is we should get those people vaccinated as soon as possible with the mRNA vaccine so that then they can make the other vaccines and then get them out to the world. That's my view.